Self-assessment for this chapter 17, the patient with personality disorder. Let's take a look at these cases. A 20-year-old woman attends her general practitioner frequently, reporting low mood. Which of the following symptoms would support a diagnosis of emotionally unstable personality disorder? Chronic feelings of emptiness, callous unconcern of the feelings of others, perfectionism that interferes with task completion, seeking others to make most of one's important life decisions, takes pleasure in few, if any, activities. For this case, this is the question. Which of the following symptoms would support a diagnosis of emotionally unstable personality disorder, which is something like borderline personality disorder? So the answer is obvious actually, because it is A, chronic feelings of emptiness. It is the only criterion listed here for borderline personality disorder. While, for example, others are related to other personality disorders. Callous unconcern feelings of others. This is for narcissistic or even antisocial personality. Perfectionism in OCD. Seeking others to make most one's important life decisions. This is for a dependent personality. Takes pleasure in few, if any, activities in schizoid personality disorders, and sometimes in dependent personality. Anyways, another case. A 45-year-old male, single and living alone, seems indifferent to praise or criticism. Okay, you can notice here what's the diagnosis from this. Appears aloof and prefers his own company. He is not depressed, and there has been little change in his situation since he left school. Which of the following personality disorders is most likely? Narcissistic, antisocial, avoidant, schizoid, or paranoid? Of course, the person here is schizoid. A 25-year-old male prisoner injured a few inmate by throwing him. 25-year-old male prisoner injured a fellow inmate by throwing him down the stairs. He states that he feels no guilt as the man was asking for it after looking at him strangely. Which of the following personality disorders is most likely? Borderline personality, schizoid, antisocial, paranoid, or anancastic? Of course, here we are talking about antisocial or dissocial personality disorder. A 19-year-old man has carved the name of his ex-partner on his chest. He reported feeling incredibly depressed since she separated from him and kicked him out of the house the day before. He is crying and tells you that he wants to die. He is intoxicated with alcohol. Which of the following is the most likely diagnosis? Acute severe depression, borderline personality adjustment, no mental illness or personality disorder, unable to say. For this case, of course, the answer is E, unable to say, because there is little information here to make any diagnosis or to exclude any diagnosis. The man here is in a state of emotional distress following a significant life event, which is compounded with acute intoxication. So initial management should focus on physical care, alleviating distress and ensuring the safety of the patient. And after that, we can do further psychiatric assessment. A 22-year-old man has a long history of self-harm, explosive outbursts of anger, impulsive, reckless behavior, feelings of emptiness, and quickly forming intense and violent love-hate relationships. He reports hearing the voice of his uncle, who sexually abused him as a child, inside his head when he is feeling distressed. He has no history of mental illness. Which one of the following would be the most appropriate diagnosis? Borderline, schizoid, dependent, paranoid, or antisocial? And the answer here will be borderline personality disorder. Okay, childhood abuse and the borderline personality symptoms. So for this extended question, Diagnosis of personality disorder: paranoid, schizoid, schizotypal, borderline, antisocial, narcissistic, histrionic, dependent, or avoidant personality disorder, of course with an anancastic personality disorder. For the following, select the most appropriate personality disorder from the list above. Assume absence of mental illness and that a diagnosis of a personality disorder is appropriate. A 24-year-old accountant wears inappropriate clothes to work. Her colleagues feel that she is always flirtatious and always seek to be the center of attention. When this does not happen, she tends to become very upset and dramatically displays emotion. So here we are talking about what? About histrionic personality disorder, of course. The second case, a 47-year-old housewife refuses to leave her abusive partner despite having recently been hospitalized after he assaulted her. She feels that she could never manage without him. This is dependent personality. A 26-year-old unemployed man is constantly preoccupied by the mischief of local youth and is concerned that he is a marked man. He cannot hold down a job as he always becomes concerned that colleagues are talking about him behind his back. His last girlfriend left him three years ago after he accused her of cheating on him. Of course, we are talking about paranoid personality. A 49-year-old successful entrepreneur, feels that others have trouble getting on with him. His fourth marriage has recently ended because of his affairs. He has always been incredibly confident and able to succeed. I think we are talking about narcissistic personality. Okay. Confident, successful, but affairs and so on. A 35-year-old website designer has difficulty making friends because of his fear of others criticizing, rejecting, or disliking him. Instead, he socializes mainly using social networking sites and will not physically meet others until he is sure will like and accept them. So we're talking about avoidant or anxious personality disorder. Okay, here we will talk about traits of personality disorder. A callous unconcern of the feelings of others. Callous unconcern for the feelings of others. Excessive sensitivity to setbacks and rebuffs. Consistent preference for solitary activities. Perfectionism that interferes with task completion. Over-concern with physical attractiveness. Frantic efforts to avoid real or imagined abandonment. Allowing others to make most of the one's important life decisions, excessive preoccupation with being rejected in social situations. So, for the personality disorders listed below, pick a common trait from the above examples. For histrionic personality, this is a good question. So, for histrionic personality usually have this excessive preoccupation with no, it's not that. They have this over concern with physical attractiveness. This is for histrionic personality. Okay, what about schizoid personality disorder? Schizoid personality have this consistent preference for solitary activities. Okay, what about obsessive compulsive personality disorder? Obsessive compulsive personality disorder patients has this perfectionism that interferes with task completion and with relationship with others. Paranoid personality disorder has this excessive sensitivity to setbacks and rebuffs. Dependent personality disorder has this G, which is allowing others to make most of one's important life decisions. So that's it. We are done here.